Okay, we'll be starting with our day 6 now. Let's see if anybody joins in between. I'll just add into the class. So we've already waited enough, I think. Revision course, day 6. Okay, so we do have some ethics cases today, and then we'll have a few of them on the last day, just in order to cover most of the important cases that are being repeated many a times. Okay, the protocol is the same, the approach is the same. We just need to practice the approach, how we need to break a bad news to a patient. Before we go on to discuss any of the cases, the thing is that whether it's this case or it's a new case in the exam, any patient who has come to you and you think that you need to break a bad news, it should always be done in this way. Even if you just imagine yourself breaking a bad news to a relative, actually in the real case scenario, sometimes when we break the news, the impact on the relative or the known person or the friend is not really that good. But believe me, if you follow the same protocol that we have, the spikes protocol, to break the news to anyone, even if it's in your real life, it's a real situation. If you follow this, the relative or the person or the friend or the family member would be able to understand you much better. He'll feel much better. Okay, so following the protocol is very, very important. So what's the protocol for following, for doing a case of breaking bad news? You always start up with setting up and starting. So how do you set up? Setting up is nothing but just that you need to have a quiet room or a place where you are not using your mobile phone. Tell the nurse not to disturb you when you are in. So just your room setup and the environment where you're going to talk to the patient, that is very, very important. At the end today, I'll share a video with you of a lady who is breaking the bad news of a breast cancer. If you just have a look at how she's doing. So there are two videos. One is the right one and one is the wrong one, the right approach and the wrong approach. If you just have a look at them, you'll come to understand exactly what I mean. So sometimes the very thin line that is there helping us to do the things in the right way or the wrong way is not approached in the right way. So setting up and starting is very, very important, that you should be sitting in a quiet room. You should not be disturbed. You just keep your stuff with you, a glass of water or a tissue box and stuff like that. Then perception. Just ask the patient, what does she, the idea, basically, what is the perception, the idea of the patient or idea of the relative about the whole situation. Okay, so idea is very, very important. Before you go on to break any bad news, you are supposed to be able to, okay, I did not share the screen with you, I just realized now. So you should be able to have an idea of what the patient is thinking about. So I hope you guys are able to have a look at this now. Just write down in the chat box if you are able to see it. Just type yes. So setting up and starting, and then perception. Then you invite the patient. Ask the patient what they would like to know. So you do not ask that very directly. So the way you are going to do it is you just first check if this patient wants somebody to be with her or with him. Whenever you ask this question to the patient, do you want somebody to be with you before I go on to disclose the news? And just this question usually gives a good idea to the patient that there might be something alarming or shocking. Okay, if the patient says yes or no, you can sometimes ask the patient that how much would you like to know, or you just go on and disclose the news. Once you've disclosed the news, then you can ask the patient if you want somebody to be with you now or you need any support at all. You do provide knowledge. So this was the perception. You checked the patient's perception or the patient's knowledge or the patient's thinking what could be there in the report, or if it's a case of somebody having something serious like an intracerebral bleed or a car accident or something like that. And then you give knowledge, provide information in small pieces. But remember that whenever you have to break a bad news, don't use 5 sentences before breaking a bad news. You need to break it all of a sudden, and then you gradually go on from there. Okay, so you have done all these 3 things, and then you break the news. I'll tell you how to do it when we do the cases, individual cases. Emotions, you need to recognize, you need to empathize, and you need to console the patient, offer her a tissue box or offer her a glass of water, whatever it is there, if needed, just to offer her or him. Strategy and summary. So in the end, you always need to set out a medical plan of action. Medical or whatever type of a plan of action is there, you always need to finish the case in a good way, wind it up in a good way, right? So let's start with our first case. If one of you can just open up your mic or maybe type in the chat box that you guys are able to hear me clearly. Okay, great. Thank you, Nadine. All right, so let's go to our first case. There is intracerebral bleeding. Okay, so intracerebral bleeding, you are FY2 working in the A&E. Who the patient is, Mr. Ali, aged 78, has collapsed and brought to the hospital with loss of consciousness by an ambulance. The initial survey has been done. The CT scan has been done and shows massive intracerebral bleeding due to ruptured berry aneurysm. The neurology team has seen the patient and reviewed his CT scan. They decided the surgery cannot be done. So this all information is very important for you, because this is the information that you are going to gradually give the patient after breaking the bad news. Okay, other information about the patient: he is breathing independently, unassisted, patient is unconscious. What you must do, please talk to the wife and explain her husband's condition and address her concerns. Special note, patient is in terminal condition and only palliative care is possible. Patient's wife does not know about her husband's condition. So how do you start this case? You go in, you greet the patient. The patient might be in distress or something. So you go in, you greet the patient, you introduce yourself, then you go on to talk to her, and she might be asking you from the beginning. In any breaking bad news, the patient can be anxious from the beginning. If, for example, there's a relative who has been admitted in the hospital, doctor, can you tell me how is my husband? Doctor, can you please tell me how is my husband? Please never stop her. Never say that, I will tell you later. I will tell you later. Once you have taken the initial details of the patient, you do tell her that I can see, always acknowledge. Whenever the patient is worried, always acknowledge. I can see that you really look a lot worried, and I'm here to answer all your questions one by one. Would it be all right if I asked you a few questions before I go on? Doctor, can you tell me how is my husband? Well, your husband is being looked after by an expert team of doctors. He is not doing very well. If you already know from the stem that the husband is not doing very well, do tell her that, well, Jessica, I can see that you are concerned, and Mr. Ali is not doing very well at the moment, and I'm here to discuss his situation with you. In order to answer all your questions in a better way, would it be all right if I ask you a few questions? So you tell her that you need to ask some questions in order to answer her questions in a better way. Then you start your history taking. Can you tell me? So you need a recap of what has happened. Okay, you need a recap of this. Why do you need a recap? Always, it's very, very important for us to assess the knowledge of the other person. We need to know how much the other person already knows. Okay, so we are assessing the knowledge, the perception of the other person, that how much she knows about it. If you just have a look over here, elicit the patient's perspective. So this is basically the recap of the whole situation. So can you tell me what happened? The patient tells you, the attendant tells you that well, we were just sitting and all of a sudden he lost his consciousness, or doctor, I don't know what happened. Sometimes this patient says that we were sitting together, we were watching TV, or we were doing some activity together, all of a sudden he lost his consciousness and he was sent to the hospital. At other times he might say that, I don't know doctor, he was out, he was not at home, and he was all of a sudden he was brought to the hospital, and I got a call from the hospital that I need to come and see. Whatever is the situation, whether she knows what happened or not, you need to break a bad news, right? So you wanted to take a little bit of history, and you already know that there's a massive intracranial bleed from a ruptured berry aneurysm. So you ask the patient, okay, if he doesn't know anything or knows anything, ask her, what did you do now? And then I just called the ambulance and sent him to the hospital. It must have been really hard for you at that time. So was he conscious at that time? No, doctor, he was not. Is it for the first time that this happened? Yes, doctor. So apart from this, any other problems? Did you notice any fits or any problems at that time? No, doctor. Has he been diagnosed with any medical conditions in the past? Was he taking any medications at all? This is more than enough. You don't need to go into the details of smoking and alcohol. If he tells you that he was hypertensive, that's it. Don't go try to finding 10 risk factors for his intracerebral bleed. Just one is more than enough, because you need to break your bad news on time. Before you go on to break the bad news, please always ask this question: do you have an idea what could be the cause of his loss of consciousness? So always ask the idea in the perception part. Okay, after taking the recap, ask her idea. Do you have an idea what could be the cause of his loss of consciousness? No, doctor, I don't have an idea at all. All right. So when you brought him to the hospital, when the ambulance brought him to the hospital, we did an examination on him, and as you told, he was not conscious at that time. We did a CT scan for him. Has anybody discussed the CT scan reports with you? No, doctor, you are the first one. All right. Unfortunately, I don't have a good news for you. Before doing this, I'm really sorry. Before doing this, you need to see if she wants to call anyone from home. Do you have anybody with you today, or do you want to call anybody to be with you? Yes or no, doctor? All right. So we assessed him. We did his CT scan. Unfortunately, I don't have a good news for you. Pause just for 1 or 2 seconds. You can even count 1 or 2. 1, 2. Then you are going to straight away break the news. Please do not put it into further layers over here. Here you are going to break the news. Unfortunately, the CT scan shows that he has a massive bleeding inside his brain. Don't say intracerebral, say massive bleeding inside his brain. Pause, wait. You may not say ruptured berry aneurysm. She will not understand. So don't use the terms for a distressed patient which are not understandable. Just say that he had a massive bleeding inside his brain. Wait and see the response. If the patient is really shocked, the patients can respond in different ways. They can be shocked, they can be loud and start crying. They might just go into a quiet mode. So anything can happen. Whatever happens, do your response, you do your reaction accordingly. I can see that you are really shocked by all this. You were not expecting a news like that. So you just explain these things to the patient, okay? So I'm really sorry for this news and stuff like that. Whatever you want to say at that time. And then you go on to wait for 4 or 5 seconds till the patient is calm, looking at you again. If you think you need to offer a tissue, offer a glass of water, whatever you want to do, if that is there on the table. Then you go on to ask her, do you want me to tell further, or do you want to call anybody to be with you at the moment? Do you want to call anyone? Okay, so offer support once again. You offered support once before breaking the bad news. If she did not take any support, you can offer support once again. Do you want somebody to be with you now? No, doctor, it's fine. You can go on and tell me what's going on. Once she says that, you start doing start telling her about your management. So now you've already done a short history. You've broken the bad news, and then you start on to your actual, start telling her the management. Tell her that most likely this could have happened because of his high blood pressure. Okay, at the moment, tell her how is he at the moment. At the moment, he is unconscious and is breathing independently. Okay, he does not have any breathing problem. He's breathing independently and he's unconscious. So doctor, what are you going to do for him now? Well, the expert team of doctors have assessed him, and they think that surgery is not going to be helpful for him. You can tell this thing yourself. Okay, you do not need to wait for the patient to ask you this question, because this is given to you in your notes. They decided that surgery cannot be done, so better not use the word decided. You can say that the expert team of doctors think that surgery is not a good option for him. It can in fact become more dangerous or fatal for him. So what are you going to do now? You are going to tell about the palliative care that is going to be. Patient is terminal condition and only palliative care is possible. So you tell her that, well, the surgeons or the expert team of doctors think that palliative care is the best care that we can provide him now. What is palliative care, doctor? It's a care that is given to patients when they are in a terminal condition. Okay, so you start telling her about the type of care. We are going to take care of his eyes, his nose, his mouth. We are going to take care of all these things. We are going to take care of his joints. In what way? We'll just keep his mouth well hydrated. We'll keep his eyes and mouth moist. We'll keep him well hydrated with some fluids. We'll also pass a soft tube through his nose into his gullet to provide him with some foods if needed. And then we'll also keep moving him from side to side to avoid any bed sores, and keep moving his joints to avoid any joint stiffness. Say this much: if you start from top to toe, it's very easy to say about palliative care. If the attendant asks you, or the relative asks you that, doctor, what is palliative care? It's just it's a supportive therapy which is designed to help patient according to their need. Okay, it is a supportive therapy which is designed to individually for every patient to help them according to their needs. Okay, so we'll be doing all these things, taking care of the eyes, of the mouth, of the dehydration, joints, bed sores, all those things. After you, and also a urine bag if you want to say, if you reach that far. Once you've done that, if the patient is too much distressed or asks you at any point, in any case, if the patient asks you that, doctor, is he going to die? Please never ever say that, yes, he's going to die. Definitely he's going to die. We've told her that he's in a terminal condition, but do not straight away say this to the patient. It's very distressing. So you always have to wrap it up into your words. You always need to wrap it up into your words. I can see that you really look worried about his condition. I may not be able to answer that very, very clearly, that how long he's going to live. But since he's in a terminal condition and he has already had one bleed inside his brain, any similar bleeding occurring again can become fatal for him. That can be life-threatening. It's not possible for me to give you a specific time if she asks that. Okay, tell her that if she asks that, doctor, do you think that I can call my family? Well, yes, you can call your family if you want to. It's always good to be around our loved ones when they are facing all this. So if you have any family members, yes, do call them. They can be around your husband. Okay, if he asks any other questions, doctor, can we shift him to the ICU? Tell her that shifting him into the ICU won't be beneficial, because we are not going to give him any active treatment. In the ICU, active treatment is done, whereas in his case, only palliative therapy is needed. Okay, so you need to address her concerns one by one. try to answer all the questions one by one. Okay. Okay. If he asks that, Dr. Soma, I'm answering that again. If he asks that, doctor, is he going to die? It's very difficult for me to answer this question. But since he had one bleed inside his brain, any further bleeding into the brain can become fatal for him. He is in a critical situation at the moment. He is in a terminal condition. So you keep using these words, but never say to the patient or sorry, to the daughter or to the mother or to the wife or anyone that yes, he's going to die. Please never ever say that. Do we have any hope? We are trying our best. We are trying our best to make things the best for him. Unfortunately, he is in a terminal condition at the moment. It's hard for me to give you a very hopeful answer at the moment. Okay, so you tell her indirectly that we don't have much hope, but don't straight away say that he is going to die. All right, this is about the SPICE protocol that we have followed. So we started with our setting up. Okay, we started with our perception of the wife about the whole situation. After recap, we asked her idea, what's her idea about it. Then we asked her if she wants to call anyone, and also about how much she wants to know. Then you want to give her as much knowledge as you want to, just in terms of his present condition. Just break it. I mean, once you've broken it, then you go gradually down the stairs. You go very gradually down. Okay, so keep seeing how your patient. Don't try to finish the station quickly. Just go according to what is being seen in the station itself. All right, let's go on to our next one. Road traffic accident, child. Where you are, so the same protocol. We are again to follow the SPICES protocol. Where you are FI2 working in pediatric emergency. Who the patient is, Joshua, aged 9, had a road traffic accident an hour ago. Other information about the patient: initial survey has been done and there is a head injury. No other injury has been found. CT scan has been done and showed an extradural hemorrhage. Please remember, it's not an intradural hemorrhage, it's not an intracerebral bleeding, it's an extradural hemorrhage. Most of the candidates in the mocks, they are saying that there's a bleeding inside the brain. Avoid saying that. You have not seen the patient. A team of doctors is resuscitating the child and planning to take him to the theater. Please talk to the parents, Mr. and Mrs. Barnes, and address their concerns. Usually only one patient in the exam situation due to COVID these days. So anyways, whether it's one or two, you need to be able to deal with the situation. Yesterday, I got a message from a candidate that doctor, there are certain points in every station that we need to know, and I think in this RTA child, all that we have been told by the academy is that we need to make sure that this initial attack of the patient's parents on the doctor need to be tackled in a very well way. If you do that, you'll pass the station. Please, it's not like that. Don't have any misperception about the situations. You need to be able to handle the situation from the beginning till the end in a good way. There is no such presentation where you just need to do one thing and then you'll be able to pass the station. It's not like that. You have to have a good history, you have to have a good IPS, you need to be able to handle any such situation in a calm manner, and also you need to have your IPS with you all the time. So there is no such station in any exams. It's not about GMC only. In any exams, there is no such station where you need to know just one thing. If you do that, you'll pass the exam. No, it's not like that. Okay, so you are FI2 working in the emergency, in the pediatric emergency. This patient has been brought in. So very, very important for you to know how you're going to do the history part, how you're going to handle the situation from the beginning. You go in, you greet the parents, and if the parents just start on their toes. They are on their toes and they are just questioning you, doctor, how is my son, how is my son, can you please tell me how is my son, is he alive, is he okay? I can see that you're really worried about your son. Always acknowledge. Do not forget to acknowledge. Don't keep postponing your information. Always acknowledge. I can see that you look really worried about your son. For me to be able to answer your questions in a better way, I need to know what's the name and age of your son. Doctor, he's Joshua, or he's XYZ, he's 9 years old. All right. Doctor, is he okay? Doctor, can you please tell me, is he okay? I can really see that you are too much worried about him. He is in, answer them a little bit. Don't break the bad news, please. Answer them. He is in safe hands. He is being looked after by an expert team of doctors, and they are doing their best for him. Because this case is a case of hope. The previous one was a hopeless case, actually. We were not having much hopes from this, whereas this is a case of hope. He's going to recover, he's going to become conscious, he's going to get better once the surgery is done. So give this information from the beginning that he's being looked after by an expert team of doctors, and they are doing their best to help him get better. So in order to answer your further questions, would it be all right if I ask you a few questions and ask you how all this happened? Yes, doctor. So now the mother or the father, if one of them is there, which is usually the case in COVID, so when you asked her this thing, she might tell you that, doctor, we were out in a restaurant, we were eating some food, all of a sudden Joshua's father came and Joshua got emotional, got up from the seat and ran towards him across the road. So he moved out of the restaurant, across the road, and reached the father. Or maybe they were just standing outside the restaurant waiting for the father to come and pick them, something like that. Whatever the story is, anyways. A lorry was coming from the opposite side and it hit the child, and he was on the floor and he got unconscious. This is the story that the mother might give you, or any other story. He had a bleeding from his hip area or something like that. She can be giving you any story. Whatever is the story, just pick up the symptoms. Okay, so what did you do then? Then we acknowledge that it must be really distressing for you at that time. Yes, doctor, it was really distressing. So what did you do? We called the ambulance and I brought Joshua to the hospital. What about your husband? He went back home with other children. So you need to acknowledge, where is the husband? You need to see if this lady is alone or with someone. So you go on to your history now. You've already taken a good recap of the situation. You start with your history. Ask her, can you tell me, is it for the first time that this happened? When he lost his consciousness, did you notice any fluid or blood coming out of his ears, nose, or mouth at all? No, doctor. Did you notice any bleeding externally on his head? No, doctor. So did he have any jerky movements of the body? No, doctor. What did you do? We just brought him to the hospital, called the ambulance and brought him to the hospital. All right, you did a very good thing that you did to bring him to the hospital. Just a few more questions before I go on to explain his condition. Has he been diagnosed with any medical conditions in the past? No, doctor. Any blood disorders or any blood thinning medications at all? No, doctor. You are not expecting that to be there with a small child, but yes, still you can ask those. And by any chance, and when did he take his last meal? That would be a very good question in this place. Okay. So when did he take his last meal? Well, doctor, he took his last meal just 2 hours back. All right. Does he have any allergies at all? No, doctor. So you took a little bit of your initial history. Then you go on to your spikes protocol. Ask her the idea. Do you have an idea what could be the loss, what could be the cause of loss of consciousness? As I told you earlier, always take an idea of the patient about the situation. Ask her what could you take the idea about. In this case, you can take the idea about, do you have an idea what could be the cause of loss of consciousness? In a case of pelvic fracture, you can ask her, do you have an idea what could be the cause of his drowsiness or his not being able to walk at all? Okay, so whatever is the presenting complaint, ask an idea if the parent or the son or the daughter has an idea about why this symptom happened. No, doctor, I don't have any idea at all. All right. So before I go on to explain, do you want anyone to be with you? No, doctor, it's okay. You can tell me. My husband is at home with other kids, or any story, whatever she tells. All right. As you told me, you brought him to the hospital and he was unconscious. We also found him unconscious, did an examination on him, and then the specialist sent for a CT scan of the head. Unfortunately, I do not have a good news for you. Pause, see the reaction of the mother, and then break the news. The CT scan shows that there is bleeding on the outer part of the brain, between the brain and the skull. Okay, so between the layers and the skull. So it's not inside the brain. Remember that you need to tell this. There's a collection of blood over there, which is compressing on the brain, and that is the reason for his loss of consciousness, most likely. Okay, pause, see the reaction of the mother as we did earlier. If she's reacting a lot, she's crying a lot, you can see the tears, you can offer a tissue. If you can see that she's just quiet, just stunned, not able to answer anything, you want to offer water. If that is there, you can offer water. Whatever is present there, and whatever the patient's reaction is, accordingly you offer her some support. So this water and tissue is what? This is just a support. So you ask her again, do you want to? I can see that you're really taken away by the news, or you're really feeling distressed after hearing that, or I can see that you were not expecting this to happen. Do you want to call your husband now, or any friend to be with you at the moment? No, doctor, it's okay. You go on and tell me what's going to happen now. Or she might start blaming herself. I'm not a good mother and blah, blah, blah. If she does that, reassure her. I can see that you are really distressed and thinking in this way. You are a very good mother. That's the reason you brought him on time to the hospital. So, do you want me to tell you further what we are going to do for him? Yes, doctor. So the expert team of doctors, never say decided. The expert team of doctors think that he will benefit from surgery, and we need to do a surgery. Many a times in the mocks, what I have observed is that the candidates break two news together. One is that he has intracerebral bleed, extradural bleed, and the second is that he's going to have a surgery. Please take it step by step. Don't give the management at the time of breaking the bad news. Take both these things one by one. Because surgery itself is a bad news for the patients. It's not a good news to have a surgery, right? So once you've told her about the situation, once you've told her about the surgery, we need to remove that blood from the outer part of the brain, so that his symptoms can be resolved, and he regains his consciousness. Oh my God, doctor, he's going to have a surgery. Oh my God, he's such a small child. He's going to have a surgery. She'll be distressed. Whatever she's reacting like, please keep acknowledging, keep reflecting. Say that, I can see that you're really, really distressed at the moment. You are too much worried about him. It's very natural for you to be worried. I'm here to support you. The surgery is really going to help him a lot. It will be done in expert hands by expert team of doctors, surgeons, pediatric surgeons in the hospital. Are there any complications from the surgery? Please always tell the complications in a good way. These cases, the breaking bad news, I have felt that most of the candidates, they do struggle. That is what I've assessed. I never said that to you before, but today I'm saying this. In breaking bad news, I have seen many candidates struggling a lot. So when it comes to complications, don't just close your eyes. You need to say that, but need to say that in a good and hopeful way. How do you say that? Well, Jessica, yes, there are some complications which are associated with every surgery, some short-term complications and some long-term complications. The short-term complications can be bleeding from different areas, or it can be some infection. And the long-term complications in terms of brain surgery can be weakness in a part of the body. Don't give big words that he will be paralyzed. Just say that sometimes there can be weakness in a part of the body. But I reassure you that it's going to be done in expert hands. The doctors will try their best to avoid any such complications for happening. We have very expert doctors here in the hospital. Tell her that there are complications, but it will be done in safe hands. He is in safe hands. It will be done by expert team of doctors. So keep giving her hope so that she's happy that we want to go for the surgery. Are you okay with this? I want you to consent for the surgery. Yes, doctor, I'm okay with it. So can I call my husband? Yes, sure, you can call your husband to be with you. Is he going to die? We are hoping the best for him. Give her a lot of hope, please. This is a hopeful case. This is not a hopeless case. So give her hope. We do hope that he is going to benefit. If she asks that, what type of a surgery is going to be done? Well, there are different options. Don't say that only the expert surgeon can answer you that straight away. Say that there are many options, but the surgeon will assess him and see whatever is the best. He will do that for you. Do you want me to arrange an appointment with the surgeon? Okay, if that is the case, doctor, can I see my son at the moment? Well, you surely can see him at the moment. He's being resuscitated. He's being They are planning to take him to the theater. So let me just check with the seniors and get back to you if he has already been taken to the theater, or you can see him. Okay, but don't worry, I'll definitely get back to you. Don't say no. Don't ever say no to a patient to a mother or a father whose child is going for a surgery. Please never say no. That's my sincere advice to you. Just imagine yourself in the similar situation and see if the doctors are refusing for you to see to see your loved one. I would never like that idea for myself. So never say that. Never say that. Okay. Just put it on the seniors and let the situation go. That's all for this case. So break your news in a good way. Practice this as much as you can. Practice is very important here. Let's go to our next case, HIV, where you are FI2 working in the GP, who the patient is 7 years old. Jordan has come for his reports. 27. 27 years old Jordan has come for his reports. HIV is positive, confirmed by testing twice. He is... No, this is written here wrongly. That was just for a box that I wrote it here. Other information about the patient is none. What you must do, talk to the patient, discuss the results, address his concerns, and manage the patient. This one can come as a telephonic station or a face-to-face station, whatever. You are going to break the bad news. Okay, so in the same way, but definitely it's going to be a little bit different, not as bad as those news which you've already given. There the situation is very distressed. Here the patient has given his tests last week or 2 weeks back, so he might be mentally prepared for having an HIV, having or not having an HIV. So you go in, you greet the patient, you acknowledge that he's here for his reports, for his all his STI reports. It's not going to be just HIV. It's going to be a complete set of reports saying that chlamydia is negative, gonorrhea is negative, syphilis is negative, everything is negative, and only HIV is positive. Okay, so you go in, you greet the patient, you acknowledge that he's here for his reports, and then you ask him, would it be all right that I asked you a few questions before I go on to disclose the reports? Yes, doctor, that's fine. Okay, so can you tell me why were these tests done in the first place, doctor? It's just that I have some lumps in my body, or what can be the presentations of an HIV? The patient can come with a chronic cough. The patient can come with some lumps. The patient can come with some weight loss. These are the situations in the young people which can present with HIV. These can be a few way of presenting for the HIV. So anyways, most likely with the lumps. Okay, so can you tell me where were the lumps? They were all over my body, in my neck, in my groin, in my armpits and stuff like that. All right. So apart from lumps, any other symptoms at all? Like what, doctor? Have you had any weight loss? So you are going to complete your flaws here. One thing you've already got, so complete your flaws here. Lumps and bumps, he told you. Have you had any weight loss, any loss of appetite, any fever, flu-like symptoms? Yes or no, doctor? All right. And what was told? What was told that what tests are being done? Doctor, I was told that they're going to test me for the sexually transmitted infections. All right. And would it be all right if I ask you a few personal questions? Take the sexual history. We already discussed that yesterday. Let me say that once again, just for a recap. Are you sexually active? Are you in a stable relationship? Do you have any casual partners? Are your partners male or female? Do you practice safe sex? All these questions you need to ask. Okay. And then what's the preferred mode of sexual activity? The preferred route, actually. Okay. Oral, vaginal, or anal. You can ask that. HIV, who is at greatest risk of HIV? Men who have sex with men. So MSM, there is something called as MSM. MSM are at greatest risk of having HIV whenever they have unprotected sexual intercourse together. So this is what you need to know. This patient might be an MSM. Other information about the patient is none. So you just have taken this much information and then you go on to your quick, short maftosa, not very detailed one. So in the maftosa, you can quickly ask him, have you been diagnosed with any medical conditions in the past? Are you taking any types of medications at all? And then ask him, do you smoke? Do you drink alcohol? Do you have an idea? Now you're going to the Breaking Bad news. Do you have an idea what could be the reports showing? Well, doctor, I'm just conscious about it. I don't have an idea what could be there. All right. Well, Mr. X, as you told me that you had some lumps, so you are going to paraphrase just the way we did in the previous two cases. As you told me that you had some lumps and you were checked for sexually transmitted infections, I've got the reports with me. All the reports, most of the reports, not all, most of the reports have come out to be normal, like you do not have any gonorrhea, any chlamydia, any syphilis. Tell them one by one, HCV, hepatitis B, whatever you want to say. But unfortunately, I don't have a good news for you in terms of HIV. I would never advise you to ask him for the presence of a friend or wife or someone with him when you are disclosing the news. So never ask him, do you want somebody to be with you? If you want to ask, that's fine, but I don't prefer that to be a question in the beginning. Tell him that your HIV has, your HIV test has come out to be positive. He'll be quiet. He might be shocked, less likely, but he'll be quiet most likely. Okay, because he's already given you some positive things in the sexual history. Once he's quiet, just acknowledge that I can see that you're really taken away by this news. Maybe you were not expecting this news. Okay, I'm really sorry to tell you that. Yeah, that's the report. That's what the report shows. Doctor, could it be a negative? Could it be a false report? Can we do the test again? Well, you're right, Jack. Sometimes the reports can be false, but we have already confirmed it by testing your sample again. So we always check it twice before opening up to the patient. Okay. Wait for a few seconds, again, just like the BBN case. Now ask him, do you want someone to be with you? Now he already knows that he's HIV positive if he wants someone to be with him. If he says yes or no, that's fine. Then you go on to your further steps. What are the further steps? You tell him that, do you want me to tell you what we're going to do further for you? Yes, doctor. Well, I'll give you a referral to the gum clinic. Send him to the gum clinic. Either this case can come in the gum clinic from the beginning, like this, GUMCLINIC. gum clinic, okay, working in the gum clinic. He might come to the gum clinic for this, or he might come to the GP for this. Wherever he is, you can send him to the gum clinic. Tell him that what would be done in the gum clinic. In the gum clinic, once you're there, they are going to start you on some treatment for this HIV. If he says that it's a life-threatening condition or something, tell him that. Yeah, in the past it has been a really life-threatening condition, but now if we take the treatment regularly and we take care of our blood tests regularly, and we keep ourselves checked and we prevent any future exposure to HIV, it's very normal for a patient of HIV to live HIV. Where you are FY2 working in the gum clinic. Your patient is 27 years old. Jordan has come for his reports. HIV is positive, all other reports are negative. Other information about the patient is none. What you must do, talk to the patient and discuss the results, address his concerns and manage the patient. So you've already broken the bad news to the patient. You've done all those things. You've already taken a very good history from the patient, taken a history of any like all the meftosa, all the signs and symptoms, and all the sexual history, meftosa, travel especially, casual partners, and if he has had sex with his wife after coming back, after having sex with the prostitute or something like that. Whenever he gives you any positive history, always ask him if he had sexual intercourse with his wife after having sex with the casual partner. Okay, then you come on to your examination part. You just say a little bit about the examination and you start telling him about the results that you have. You've told him about the reports, that all these things came out to be negative and HIV is positive. Since HIV is positive, we have already confirmed it by testing it twice. So this is the true and the final report. If this patient is worried, just tell him we've already done the spikes protocol. We just discussed it. So we are going to tell him what is going to be done in the gum clinic now. Okay. Once he goes to the gum clinic, he will be offered a few things. He will be offered some medication to be taken lifelong. He will be tested for certain things regularly, like his CD4 counts and the quantitative test for the HIV. All those things will be done regularly. Whenever the CD4 count is very low, then this patient is prone to infections. You just need to know it for your knowledge. Otherwise, you don't need to say it in the exam. So you just tell the patient that a few tests will be done for you regularly, just to make sure that your immunity is up to mark. You will be given a medication, an antiviral medication, 1 or 2 tablets to be taken throughout your life. Okay. Then advise him about using prevention in future. Tell him that it's very important that he goes and disclose this to his wife, because she is also at risk of having an HIV. If he has had an intercourse with his wife after having an intercourse with the casual partner, then he is when he tells his wife, then his wife will also be tested for HIV. Okay, in the gum clinic, they are going to notify all his previous partners through the partner notification program. If he is worried about HIV being a life-threatening condition, tell him, reassure him that in the past, yes, it has been a big stigma, as well as it has been a difficult to treat type of condition, but now it's quite manageable by doing regular follow-ups, by doing future prevention, by using barrier methods. Just tell him all these things. I forgot to mention that in the specifically, although I mentioned meftosa, but in meftosa, don't forget to ask about illicit drugs as well, because as we know that tattooing, IV drug use, these are all risk factors for HIV as well. So do talk about all the risk factors so that you can advise him about the risk factors. Encourage him to talk to his wife. That is very, very important. This patient might say that, doctor, I do not want to tell my wife. Here is your moral obligation to convince him. Don't ever threat him. Don't talk to him in a judgmental way. In fact, try to convince him by saying that, see, Mark, if you won't tell your wife, she is at risk of contracting the disease. If she contracts the disease, she will be at risk without knowing that she has the disease. She'll go on like that. Okay, so it's very important that you tell her, doctor, I do not want to tell her. Well, I can see that you're really worried. Do you want us to tell her in a different way? Do you want our help in terms of telling? So offer him help first. Okay, he's refusing. First tell him that why it is important. Then he's refusing. Then tell him, ask him if you want our help or the help of the gum clinic to disclose this news to your wife. We are here to help you out with that. No, doctor, I do not want to tell my wife at any cost. Well, Jack, it's my duty of care towards your wife, being a health professional, that if you will not tell her, I'm sorry to say, be still nice and humble and kind to the patient, even if he's saying that I do not want to tell my wife, because your communication skills are being tested. So tell him that if you won't tell your wife, then we might have to tell her. He might be a little bit annoyed. Why are you going to tell her? Well, we won't tell her without informing you. If we need to tell her, we'll definitely inform you. But this is according to the law, that if you do not tell her yourself, if she doesn't come here for getting herself tested, then she is at risk. And you might have to face some legal consequences as well in the future if you won't let her know that she is at risk of having the HIV. Okay, because the wife is innocent, she doesn't know whether she's at risk or not. So you do need to tell her if this husband is not telling, but do it in a very nice manner so that you are able to convince the husband. Our duty is not to threat the other person, our duty is to convince the other person. That's why it's more of a counseling and ethical sort of exam. You have to do everything in a nice way, even if you think that it's the patient's thing, he was on the wrong track and stuff like that. You still have to be very nice and gentle and humble, because you need to keep this help available for this patient in future as well. So you need to maintain a good doctor-patient relationship. So do your things in a good way. So it's just like the driving. It's just like the driving. In driving cases, we always advise the patient to inform the DVLA. If you do not inform, I have my duty of care towards the public that I will inform the DVLA. But before informing the DVLA, I'll definitely let you know. I'll inform you first, so that if you change your mind, you want to do it yourself, then we are more than happy for you to do it yourself. Okay, so this is about HIV. Any questions we can take in then. Do not worry about the questions, whatever different questions are there. All right, so let's go to our next case for the day. We have a spiral fracture. So now we are coming to the abuse cases: spiral fractures, sex trafficking, and domestic violence. It's always very important to take a good history. In spiral fracture as well, up till now, all the candidates who have done this case with me, I think I've seen none doing it in the right way. You do know that you are going to involve the social services. You know that it's a twisted injury, but from the beginning, please be non-judgmental. Don't be judgmental with the patient. It's very important for us to be non-judgmental. So when this patient is coming to you, the lady, how it comes is that this lady is coming to you saying that, doctor, I noticed this swelling in the arm of my baby. So 4 months old, 4 months old, not here, 4 months old male child was brought to the hospital by his mother. She rushed to the hospital when she noticed the swelling in his right arm. Other information about the patient is none, and X-ray has been done and a spiral fracture of the right humerus was noted. So when you start taking up this case, always take a good history. Don't straight away jump to the biological father. This is a very bad thing. Please, it's a bad thing, totally wrong that you go to the biological father thing. Do you think that a biological father will never do a thing like that? They can do. Okay, it's not necessary that it's just going to be his her girlfriend, her boyfriend who has done it. So just please don't jump to this question. Don't be so judgmental from the beginning. If somebody asks that question to me from the very beginning, the fourth question or the third question in the consultation, I'm really going to feel very bad about this doctor actually. Okay, so how are you going to do? You go in, you greet the patient, and you and it's in the A&E, A&E. So you are going to go in, you greet the patient, to introduce yourself, take the details of the mother and the child. You start taking your history. So what brought you to the hospital today, doctor? Actually, I came back from work and I noticed that there was that Jack was really crying a lot. He was continuously just being crying, and he was irritated. He was irritable. I don't know what's wrong with him. When I changed his nappy, I noticed this swelling on his arm. Okay, I'm really sorry. Can you tell me more about the swelling? Start taking your history. Always take a good history. Which arm was that? It was the right arm. Exactly where was the swelling? It was in the middle of the arm. Okay. And did you notice that the swelling was increasing with the passage of time? And did you do anything to make it better? Do a history of the swelling. Okay. Make the mother feel a little bit normal first. Ask her, have you noticed any swellings anywhere else? Although you know it from the beginning that this is a spiral fracture, you are not ruling out your differentials. You are not going to be asking about bruises and colored eyes and stuff like that. In fact, you are going to take the history of the swelling. Did you do anything to make it better? Did you give him any medication? Doctor, I gave him some paracetamol, but it didn't help much. He was still crying. Okay, what is your next question? How long did it take for you to come to the hospital? You want to rule out neglect. You want to see if this mother brought the child to the hospital about after 12 hours of seeing the swelling. Okay, so you want to rule out neglect. Ask her, how long did it take for you to bring the child to the hospital? Doctor, I brought him immediately. That's really great, Jessica. So apart from the swelling, did you notice anything else at all? No, doctor. So when you came back from work, as you told me, who was looking after Jack at home? It was my partner. All right. And did you ask? So no biological father question here, please. Okay, up till now. Even till the end, I can go without that in this case. So you ask him, did you ask your partner that what happened? Yes, doctor, my partner told me that he had a really rough night, or maybe my partner told me that he has been really cranky the whole night. Did you ask him what does he mean by a rough night, or did you ask him why has he been cranky, or what does he mean by he has been cranky throughout the whole night? So you always ask, if the partner has given any statement, you always ask this lady that did you ask him what does he mean by that? Okay, so what is your history going to be ahead of this? No, my partner said that he has been crying a lot. Any particular reason? Anyone else who looks after your child except you and your husband? Was there anyone else with your husband at night, or with your partner at night, who was taking care of the child? No, doctor. Yes, doctor. Whatever she says. All right. Just to make sure that everything is fine in his surroundings, I want to ask you a few more questions, and everything is good with his health. So you are normalizing the situation now. Okay, ask her the birth's questions. Any birth, any problems at birth? Is he up to date with his jabs? You've already asked her that is it the first time that this has happened? Okay, and do not go on to ask that this a planned pregnancy. Okay, this question also looks very bad, especially when the mother is so caring. She's so nice. You brought the child immediately in. It means that most likely it's nothing from the mother. You're not suspecting that to be to be the case. Okay, then you go on to take your binds history. You complete your binds history, nutrition, development. In terms of nutrition, you can always ask that, since you saw this swelling up till now, What did he take his feeds? Was he feeding well? Okay, and anything at all. So after doing that, you go on to tell her that just a little bit about his environment. So you and your husband or you and your partner look after John only, right? Yes, doctor. So a little bit about your lifestyle. Do you smoke? Yes or no? Do you and your partner drink alcohol? Yes or no? Do you use any illicit drugs? Please bear with me. If she looks annoyed, please bear with me. It's just a routine question we always ask all parents when they come to us. Okay, well, they are not annoyed by these questions, but just in case if you are feeling a little reluctant or so. Once you have done a good history, so you have explored the environment as well, you go on to your explanation. Tell the mother that, well, you brought him in here. We did an examination on him, and we also noticed the same swelling which you told me. So we did an X-ray for his arm, Jessica. The X-ray shows that he has a spiral fracture. Use the word spiral fracture first. Always give your diagnosis first, okay? He has a spiral fracture of his upper arm. Wait and see how she is reacting. You never wait and see in these scenarios. I don't know why. She's a mother. She's so caring. She's so nice. You brought him immediately to the hospital, and you are going to tell the mother that I'm not saying that do it as a BDN and ask her to call someone to be with her, but at least be a little bit humble to break the news. Tell her that he has a fracture on his arm. If she responds, Dr. Fracture, how come could he have a fracture? Yes, Jessica, just the way you are alarmed, I myself am a bit concerned about it. Tell her that you are concerned and I'm also concerned, because this type of injury usually doesn't happen in small children. It happens only when we twist the arm. Okay, it's something we call as a twisting injury. You can say like that. Wait for the lady to respond. She might say, what do you mean by that, doctor? Do you think that somebody twisted his arm? Well, I'm not really sure how to answer this question, but whenever this type of injuries occur, we do need to take a few steps, okay? So at the moment, don't involve the social services immediately. At the moment, I need to admit him, call the senior pediatrician to have a look at him as well, because we need to manage the fracture. I will give him some painkiller. We will send for some baseline investigations, and we will also need to involve the social services. Why are you going to involve the social services? If the mother asks, well, Jessica, we just need to involve the social services because we want to make sure that everything in Jack's environment is good and safe for him. Okay, so sometimes the candidates, when they are doing this case, they tend to give long explanations first, and then they go on to talk about the spiral fracture and then the social services. Please don't explain so long. Don't waste your time. Tell the management in points. He has a spiral fracture. That's what we found on X-ray. It's a twisting injury. Go gradual. We need to admit him. Involve the senior to see how to manage it. I will give him some painkiller. We will send for the baseline investigations. And we also need to involve the social services. Why? Because we want to make sure that your child is in a safe environment. There are no problems around. Are they going to take my baby away from me? No, Jessica. They're not going to take your baby away from you. They're just going to come and question you and ask look for some details just to make sure that he is safe. He is in a safe environment. Okay, they're not going to take the baby away from you. That's it. That's what you need to do in this case. All right, so let's go to the next one. That is sex trafficking. One of those cases which has been, which seems to be problematic for many. The reason is just the way you do it is not you do it. The way many of the candidates do it is wrong. You start pushing you start cornering the lady, trying to ask her to open up. You start giving her the confidentiality 10 times. Please do not do that. As I said in the spiral fracture, you need to take a good history. Keep going with your history in a normal, calm, and gentle way, and this lady will definitely open up to you. Don't start asking her from the beginning, whom did you come with, whom do you live with. That should never be your first question, that whom do you live with. That seems totally scripted. Okay, so you are FY2 working in the GP. 25 years old Olivia came to the hospital with a burn in the abdomen. The nurse has done the dressing. So you know that she had a burn. Ask her a few questions around the burn. Ask her, the nurse has done the dressing. Do you have any pain? Okay, so ask some questions around that to build a good rapport. Your patients always need some rapport to be built in order to open up to the doctor. They will never ever open up if you are not able to build a good rapport. Even after 6 minutes, they may not open if you have not built a good rapport. So start building a good rapport from the beginning. Go in, greet the patient, tell that I can see that you are here for this with this burn. Is that right? Yes, doctor. All right. Can you tell me what happened? She may not be making a good eye contact. She may not be looking at you. Just tell her that I can see that you look a little bit low. Just want to know about this burn. That uh, how did you get this burn? Or when did you get this burn? Is it for the first time that you had it? And what did you do then? How long did it take for you to come to the hospital? The dressing is done by the nurse. So do you have any pain now, any bleeding from the burn, anything like that? So do ask all these questions to your patient. Okay, once you're done with your questioning about the burn, so first of all, burn history in this case. Once you've done the burn history, then you go on to ask this lady that I can feel that you really look low, because she is looking low. But look low doesn't mean that she's looking low. It means that your mood looks down. Okay, so you really look low, and is there anything that's bothering you? Do you want to talk about anything? If she doesn't talk about anything, please tell her that, well, Jessica, many different patients come to us with different issues, different problems in their environment as well. So it is an environmental issue, right, that you're going to address. So tell her that there are many patients who come to us and then they have many environmental issues as well. And we are here to help all our patients in different ways. If you have anything that you want to talk to me about, please welcome. I am here to help you out. Tell her this thing, then you go on to your remaining history. If she doesn't open up, don't keep throwing confidentiality. Tell her that everything that you discuss will remain between you and me. That's it. Don't give any other statements of confidentiality. You and me is more than enough, okay? Then you go on to your meftosa very gradually. Just to make sure that your health is fine. Have you been diagnosed with any medical conditions in the past? Are you using any medications? Just want to know, what do you do for a living? Whom do you live with? Okay, so now you're gradually coming to her background. Whom do you live with? She might answer or she may not answer. All right, that's fine. You keep going. Do you smoke? Do you drink alcohol? Are you sexually active in a stable relationship? So when you go gradual, when you go slow, she will definitely open up to you. All right. Keep acknowledging whenever she looks low. Acknowledge 2 to 3 times throughout your history taking that I can see that you look disturbed. I can see that you look worried, or I can see that you look low. Say something like that throughout your consultation. Okay, and I am here to help you out with anything that you have in your mind. Once you've done that, if this lady opens up to you at any point, quickly, the examination has already been done, so you may skip the examination on now. You started with the burn and stuff, right? So you just go on to your management now as soon as she opens up. Doctor, I do not want to go with that man who is outside. All right, Jessica, I can see that you're concerned about the man who is outside. We'll definitely be here to help you out. Can you tell me more about who this man is? Well, doctor, he brought me from XYZ country, And okay, so when did he bring you? It has been about 6 months now or 1 year now, whatever she tells you. All right, and was there any particular reason that he brought you here? Do your parents know about it? Not very long history. If you have already reached 2 minutes, if you have not yet reached 2 minutes, the 6 minutes time, then you can ask a little bit of history. Okay, just like that. So what does he do? He brings men into the home, and then he uses us for sexual activity, and they are drunk, and they are doing some drugs and stuff like that. All right. So as you told as you told that he brings men, are there any other females as well? Yes, doctor, there are many other girls that he brought from XYZ country. All right. I'm really sorry to hear about what has been going on with you and with the other girls. And I'm glad that you opened up to me. I'm here to help you out with this. This is something, so now you're giving your diagnosis. This is something we call as sex trafficking, when people are brought for the purpose of for having sex. And this is something that is considered illegal in the UK. So don't be asking her about her UK passport and stuff like that. Please, no need of asking that. That has been also a question by many candidates in the past. Do not ask those questions. Just tell her that this is illegal, for anyone to bring someone for the purpose of casual sex with multiple people and blah blah blah. So now you are in safe hands. I'll involve some safeguarding services, and we might also need to involve the police. But please do not worry. You are in safe hand. Your shelter, your food, your finances will be taken care of by very nicely. We will admit you now. Admit her. She's in the A&E. You have got a chance to admit her. Tell her that just to manage your burn, we are going to admit you now. We will involve these services, and we will be taking care of the other ladies as well who are at home. This is more than enough for this case. Don't go into any unneeded details for this case. Okay, this is all what is needed. So in order to perform it in a good way, please don't jump on to ask her, whom do you live with? It simply looks scripted, that you know that there is some problem at home. Okay, you know that there is a man behind this lady who is doing all this stuff. Okay, you know from the burn that this case came earlier for your friend as well. Please do not do that. It might be a different case. GMC might change it completely inside. Who knows what's going on in? So you go with your natural flow in order to complete your case, and not to be scripted as well. Do not use any wording that has been told to you by your friends or anyone, right? That's the best thing you can do to yourself in the whole GMC exam. Domestic violence, almost similar, not much difference, but the management, this lady might not want to complain against her husband or something like that. Okay, so domestic violence, since it's very common in the Western world as well, in our countries it goes unnoticed because there is so much violence that you can't count it. In these countries, they do support their citizens. They have placed us in place. So this is very important for us to know. One of the reasons these patients do not open up to GP, if you read about it, why do we need to bring in confidentiality? Why do we need to put in efforts to build rapport with these patients? Because these patients who undergo domestic violence or sex trafficking or anything, any type of violence, these patients are not aware of the fact that GPs can help them. So you are in place. It's your duty of care towards the patient to make sure that if any patient who has come with an unusual type of an injury, unusual type of burn, coming with multiple problems every week, having a head injury, having an arm injury, having a leg injury, every other day she has some sort of an injury. So it's your duty of care towards the patient to suspect that it can be a case of domestic violence. or something that's bad in her environment. So we explore that further. You are referred to working in the medicine. Who the patient is? 32 years old Elena came to the hospital with insomnia. The patient might come to GP or to the hospital in the medicine department. If she has been to the GP, and the GP might have sent her to the hospital. Anyways, she's in the hospital now. So you start taking the history from the patient. How may I help you? Doctor, I've been having some problem with my sleep. All right, can you tell me a little bit more about it? Since when have you been? So what type of sleep issues can these patients have? Patients who have anxiety can have problem initiating sleep, and patients who have depression can have problem maintaining sleep. Just keep that in your mind. This is very, very important for us to know. Okay, so when you start taking the history, since when have you been having this sleep issue? And how many hours are you able to sleep when you go to the bed? How long does it take for you to fall asleep? And once you are asleep, are you able to go on continuously in one go for 7 to 8 hours or not? Okay, so ask your all sleep questions in a normal and natural way. Don't be scripted. Don't jump onto domestic violence. Let her open it up at whatever time she will want to open up. Okay, so you keep taking your sleep history. Do ask her a few questions about her health. Ask her if you snore at night, if you have lack of concentration, any mood problem. Okay, in the previous case as well, I'm really so sorry to say, I missed on highlighting the mood. So whenever I say snaps, I'm talking about mood as well. Whenever I say snaps, okay, so smoking, nutrition, alcohol, physical activity, and stress, they all come together. So in this case as well, just go on to these snaps. She might open up to her to you herself, saying that, doctor, I have problem at home. My husband has been very loud to me, and he has been hitting me, or he has been like that, or this or that. The problems, whatever type of problems she had. This lady might open up herself. If she is looking too low, down and low, then you are the one who is going to open her up. If she is active, she is actively giving you in history, she might open up. Most likely she will open up to you. She's a little bit confident patient, and she might open it up to you herself. Okay, telling you that, doctor, my husband hits me every night. He drinks, he smokes, he uses illicit drugs. All right, you start taking your history. I'm really sorry to hear about what you've been through. It must have been really hard on you, and I'm glad that you told me. Always appreciate the patients when they open up to you. I'm glad that you opened up to me, or you gave me this information. Just to make sure that you are safe at home, I would like to ask you a few more questions. So you told me that your husband physically abuses you. Does he ever sexually abuses you? Any financial abuse? Look for that. Okay, look for neglect. All these things need to be looked for in any case of abuse. Do you have any kids at home? Has he ever hit his kids as well? Does he ever hit his kids as well? And how many children do you have? Do they see him doing all this to you? So that is another type of abuse. That is an emotional abuse for the kids. If they see their father hitting the mother, remember that. Okay, so emotionally abused kids, when they grow up, they can have very bad anxiety and depression. They can have very bad psychological issues if they grow up with an emotional abuse in their mind. So you need to explore all that. So do you yourself smoke, drink, use any illicit drugs? So you need to be able to take a good history. Once you've done with your good history, you've asked her about her mood issue, then you go on to do a quick examination on her. A quick examination, checking her observations, and say that I'll just have a look at your just check for her thyroid gland, her heart, her tummy. Just generally, you need to explore that if there is any other cause of sleep. So if we talk about sleep overall, there are some medical causes of having sleep issue, and then there are some psychological causes of having sleep issue. In this one, you come to know that this patient has a problem that is falling under the psychological issues. She might tell you that I'm unable to sleep when I go to bed. I keep thinking about that. I keep rolling in my bed. I have fast racing of the heart. I feel fatigued or something like that. She might say that I feel irritable as well. I feel like crying all the time. Whatever things she's taking, keep picking up those into your history. You've done the examination, then you come on to the management. In the management, always, if she's coming to you in the hospital, tell her that we have a lot, wherever she's coming, sorry, the hospital point is later. So you tell her that we do have a lot of support that is available for you. Thanks for opening up. From all the information that you've given to me, this is something we call as domestic violence. Always give your diagnosis in a good way. This is something we call as domestic violence. And domestic violence or any other type of violence is not at all acceptable in the UK. Say this sentence, it's not at all acceptable in the UK. We have a lot of support and help available for you. Do you want any support in this regard? Do you want us to give you any shelter, or you need to explore the need of the patient? Okay, you can't forcefully send her to the to the shelter home or any support services. Okay, so you need to explore her need, if she wants help or not. Do you want help in this regard? Yes, doctor, I do need help. All right, I'm really glad that you decided for yourself. There are many services that are available. I'll send you to an appropriate department within the hospital, where an appropriate person who deals with the case like yours, he will give you some contacts of the support services, the shelter homes, the 24/7 domestic violence helpline. He'll also give you some numbers of the hospitals where you can always contact when you want to. So you are sending her to some shelter home, the women's shelter home, where they can get shelter. They will have all types of financial, food, all types of support will be there. If he says that, doctor, I do not want to, now this is very important, I do not want to go anywhere, I want to stay with him. In that case, you are going to give her the information. Tell her that we do have a lot of help that is available in the community for you. We have shelter homes. We do have some helpline services as well. We do have some special numbers, some special applications which can help you a lot in this regard. So what I advise you is that please do inform your friends or your family members or your neighbors about your situation, so that if you ever need any help, you can seek some help. Okay, so you have already done Meftosa. You have already explored her, whether she has any support at home or not, or in the family or not, if she has already discussed this matter with any of her family members or not. If she says that she has, appreciate her. If she has not, then encourage her to discuss it with her family or with her neighbors, so that people around should be aware of her situation. Give her the helpline numbers, give her the contact number of the hospital, give her all the information that you have in a good way, so that if she ever needs any help, she can always come back to you and dial all these numbers, 24/7 domestic violence helpline number. Also tell her that try to keep your important documents and your money and stuff like that separately in a safe place, where if you ever need, you can always take them and move out of the house. Okay, so things shouldn't be scattered for her. So try to give her some tips in this regard. If there are children at home, in this case, you always need to involve the child protection services. You can never ever ignore that. You have to involve the child protection services if there are children at home. Whether she agrees or not, you know that CPS needs to be involved if there are children at home and all this is going on in front of them, or if it is going on with them. All right, so this was our domestic violence case. Next, we go to, we've already taken a break enough, so let's keep going with our cases without taking any further break. You are FY2 working in the GP. Who the patient is, 28 years old Rihanna, came to the hospital yesterday with an ankle sprain. She was managed and sent back home. She has come back today to get her X-ray report. and what you must do, talk to her and address her concerns. It can come in any way. It can come with an ankle sprain. It can come with a cervical injury or something like that. Okay, so whatever is the case, you always need to approach the cases in the same way. If a patient has been to the hospital yesterday and is coming again for the report today, you always start with the recap, ask her for the present symptoms, and then you go on to explain the reports, right? So you go in, you greet the patients, introduce yourself. I can see that you're here to get the X-ray report of your ankle that was done yesterday. Is that right? Yes, doctor. Well, okay. Thanks for coming in. Before I go on to tell you the report, would it be all right if I ask you a few questions? Yes, doctor. Start asking her what happened. Doctor, I had this fall at my workplace yesterday when I had this ankle issue. Maybe I have had a fracture of my ankle. Oh, okay. All right. Can you tell me more about that? How did you have this fall at your workplace? Well, doctor, I was just walking from one seat to another or doing something at the workplace, and then I had this fall. All right. And did you have any support around? Did you by any chance hit your head? Did you twist your ankles? Yes, doctor. So was there any swelling, any bleeding anywhere, any open wounds at all? Was there any pain? Yes. No. Whatever she says, just take that history. She has already given you a good recap. Then you ask her, do you have any symptoms now? So whatever symptoms she told you earlier, like for example, if she told you that I had swelling and pain, how is your swelling and pain now? Doctor, it's much better now. Okay, so were you given any painkillers or any medications yesterday when you came in here? Yes, the doctor gave me some painkiller to reduce the pain. All right, that's really good to know. And are you able to walk? Do take a walking history in a patient who has come to you with a sprain. It's going to support you later. Are you able to walk? Yes, doctor, I am able to walk, but with great difficulty. I walked in here by myself, but with great difficulty. All right. And are you able to bear your weight? Obviously, if she's walking, she is most likely able to bear her weight as well. Then you want to a little bit ask her about her background health. Maftosa, how is your work? Have you informed your employer? Ask her all those questions, and then you go on to your examination. Don't forget to examine this patient. Don't assume that he was examined yesterday, so you're not going to examine him now. Examine the patient. Say that I'll check your observations. I'll look, feel, and move around your ankle. Would that be all right? Yes, doctor. The examiner or the patient might hand over the examination report to you that all the examination is normal, or there is any mild swelling or something like that. Okay. So what were you told yesterday? That what was the problem? The doctor on duty told me that I have an ankle sprain, but doctor, I think I must have a fracture. So can you see the X-ray? Yes, I have got the X-ray with me, and your hospital notes as well that were taken down yesterday. When you have a look at the notes, it's written that she had this injury at home, not at her workplace. But now she's telling you a different story. She's saying that she had this injury at home. Okay, so you are going to tell her that I'm glad to tell you that the X-ray report shows that you do not have any fracture and it is all normal. Okay, all right. So doctor, all right. So I don't have a fracture. Yes, I'm really glad to tell you. So it will take just a couple of more days for you to be completely okay. When it comes to strains, it's just a breakdown of some fibers in your muscles, and that will be fine in a couple of days. Doctor, what about, I had to discuss with you that yesterday when I came in here, I was in too much pain and I couldn't talk well. And I by mistake told the doctor on duty that I had this injury at my home, whereas it was actually at the workplace. Can you please change the note for me, the yesterday's note for me? Well, okay. So you're telling me that you had this injury at your workplace, not at your home. Yes, doctor. Don't say a straight away no. As we have discussed earlier, always wrap it up in a good way. Wrap it up in a good way. Say that Well, okay, if that's the case, I'm really sorry, I may not be able to change the note for you, but I can help you in another way. I can help you by adding up to your today's notes that that you had a fall at your workplace by mistake. You just you gave the history that you had it, and even you can make a note in her yesterday's notes that uh, a new note. Okay, so you are not going to delete the previous notes. That is the important thing here. You can always do an addition according to the patient's request. You can always do an addition in the previous notes, but you can never ever change the notes that have been taken. Okay, remember that. If he says that, doctor, can you please completely forget the past one and make a new note for me, make a new history for me, well, I'll be able to do that, but still the old note will remain in place with your name. Okay, so you tell her that you won't be able to help her in this regard, but tell her, keep using your medication. If you have any problem, why do you want to change the note? Because doctor, it will help me get my compensation from my company. I may not be able to help you with that because it will have some implications for me and for you, for both of us. Some legal problems can happen for me and you both. So it's very clearly written in the NHS guidelines that you can give her an additional note mentioning the whole story, not only mentioning that she came with an ankle sprain which happened at workplace. So you are going to mention the whole story, that what happened yesterday and what she wants to be added today. This is how you're going to deal with her. But please don't say a very blunt no to any of your patients. We've already always discussed about it. Thank you. So herbal medication, a very, very important case. Many of the candidates have been doing it in a little bit wrong way as well, though it's a very, very easy case. You are FI to working in pediatric department, 19 months old, was diagnosed with neuroblastoma 3 months ago. He has a tumor in the abdomen which was detected by CT scan. He now has neutropenic sepsis and is currently stable. Other information, your nurse colleague saw the mother feeding the child with some green fluid from a bottle. What you must do, talk to the mother regarding the issue and address her concerns. It's very important to take a good history like always, but please, your history should not only be focused on the green fluid. You will look scripted. You go in, you greet the patient, you know that her daughter has been diagnosed with a tumor. Be very nice and sympathetic, be very caring towards the mother. Go and say that, I'm Dr. XYZ working in this department today. May I please ask your name? May I please confirm the name and age of your child? I'm here to talk about your child's health. Tell her why you are here, because many doctors have already dealt with this child. So you now are here to talk about the green fluid. So do build a good rapport from the beginning. Ask her, can you please tell me about his condition? What happened? Doctor, he was diagnosed with this tumor of the kidney. Okay, what symptoms did he have from the beginning? He had a swelling in the tummy. His tummy was getting larger and larger. So I went to the doctor, he did an ultrasound, and then they did some scans and found out that he has a tumor of the kidney. I'm really sorry, it must have been very distressing situation for you. Yes, doctor, the mother is worried. The mother needs some sympathy, okay? Always give sympathy to the one who needs it. You do need to give in some sympathy, some empathy. Then you ask her, so is he undergoing his treatment? Yes, doctor, he is undergoing his chemotherapy. How many sessions has the child had up till now? He has had about 3 sessions up till now. And these sessions, how have they been going? Well, doctor, he has been improving with them, but this time his white blood cell count really went very low, because of which he had to be admitted in the hospital. I'm really sorry to hear about that. But yes, that's a common side effect of the chemotherapy which can happen and bring down the white blood cells. So how is he doing now in the hospital? Doctor, he's improving. or she's improving, getting better. What were the symptoms? He had fever and some cough as well, and his fever was not getting away, getting better. Whatever symptoms he or she had, just ask if the symptoms are there still. Ask about any other medical problems. Is he up to date with his jabs? Jabs are very important here. This patient has a low immunity, so you want to make sure that this patient is up to date with his jabs, okay? And then how is his nutrition in the hospital? Any problem with the nutrition as at all? Any problem with the problems with the development? Ask a little bit, not into too much detail, starting from the birth and stuff. You come on quickly to your management part, okay? You can say that, well, I'm here to talk to you about something really important that's concerning me. One of the staff members saw that you were giving her some green liquid, maybe some part of her food or her diet. Oh yes, doctor, I was giving, I give him green fluid, which is actually a herbal medication, and my friend has been using that for her breast cancer, so I'm using it for my son as well. Oh, I'm really glad to know that you are so much caring for him and you are trying to help him with his tumor. Is that right? Yes, doctor. I can see that it's really distressing for you. How are you coping with all this? Do you have any support at home? You have already asked that in the beginning. So now you want to ask her, where did you get this green fluid? From my friend, doctor. All right. And do you have an idea what's there inside? I don't have any idea, but it's just a herbal medication, doctor. All right. Yes, I understand that, but there's no name, right? Yeah, there's no name, doctor. All right. And how's your friend doing at the moment? My friend is really fine. She improved after taking this medication. All right. Are you happy with the medication that your child is receiving in the hospital or the chemotherapy? Well, I'm not sure, doctor, but I want to do my best to help my child as well with this medication. So you have taken a little bit, you're not going to ask all these questions which I'm telling you, but a little bit history, which is good enough to justify yourself later. You start counseling her now. You already don't ask her, I will send her, give me the green fluid, I'll send it to the lab to be tested and blah blah blah. Please, there's no lab which is going to test this green fluid, okay? You just tell her that, Jessica, I can see that you're a really caring mom. In terms of herbal medications, unfortunately, there are not enough researches that have been done up till now on most of the medications. So any of the unlabeled medications, especially when they are there in the market, we always encourage our patients to avoid it, or we always discourage our patients from using them. Why? Because we are not aware of the possible side effects or the possible problems that the patients can have after using them. So they can either have some side effects, or they can or they can have some interaction with the medications that your child is already receiving in the hospital. So there can be two consequences actually. One is that it can have some interactions, or it can have some side effects itself. So I would highly advise you not to use it. You can also give her an example. In my GMC exam, I had it, and I gave her an example. I said that, see, Jessica, there are many medications and less researches that have been done on these herbal medications, whereas the medications that we are giving you in the hospital, they've already been researched enough. Like, for example, I'll give you the example of medication called as black cohosh, which was being used to treat breast cancer in the past for a long period of time, and which was actually later on found out, it was found out later on that it had a very bad effect on the liver. So I would highly advise you not to use these medications for your child. Okay, what do you think about it? Okay, I will think about it. Right? I'll give you also some leaflets to read more about the different types of health implications that your child can have. Okay, I will think about it. Don't force her. Let her think. Let her decide. She is the mother. She might still keep using the medication. You can't stop her. You can't forcefully stop her. Remember that it's her child and she is using the herbal medication. You can't stop her. So you just advise her to stop. Tell her why you are advising, And also, I would highly advise you to do some tests for this child in order to make sure. Just tell her that since you've been using this medication for a while now, so I would like to do some investigations to make sure that his liver and kidney function is all right. It has not been affected or impacted because of this medication. What do you think about that? Okay, doctor. Thank the patient, leave the room. That's all for this one. Okay, don't force her. Don't jump onto the herbal medication from the beginning. Okay, our two important cases, two people policy and the COVID policy. You are FY2 working in the medicine department, 91 years old female, Mrs. Anna Morgan, who is terminally ill, has been admitted to the hospital. She has been diagnosed with pneumonia or sepsis. She is on palliative treatment. She is currently unconscious and is in a critical condition. Her family member have been visiting her and surrounding her bed at the ward. Her grandson, Mr. Mike, is with her. Mike, his mother and sister visit. So there are so many people who are visiting this old lady who is 91 years old in the ward. Okay, and then they are offering some prayers around her, some rituals around her, and they usually talk very loudly, and they are in the ward, so it's disturbsome for many patients. Other patients in the ward are complaining about the noises they make and also about how the ward gets too crowded. So you have other patients' complaints. But now, please be very nice, be very kind to this grandson whom you are going to talk to. Okay? According to the hospital policy, always read the policy very carefully because you are going to bring in this policy into your consultation. And you need to counsel this patient. You are not going to command, you are not going to order, you are going to counsel this grandson that I want you to do this. Okay, according to the hospital policy, only two relatives can visit and stay with the patient at a time. 2 to 5 p.m. has been designated as quiet time in the hospital. It means that nobody should visit between 2 to 5 p.m. Okay, and at a time only two relatives can visit. So this is an old version of the COVID policy, which is new now. But since this is also coming in the exam, since many candidates have struggled performing this as well, so let's do this as well. You never know when this will start coming once COVID is over. So talk to the grandson, inform him, and so you're talking to the grandson, inform him about the hospital policies and assess his knowledge of his grandmother's condition. Give me just a moment. I just need to do take half a minute and just get back to you. Hello, yes, I'm back. I'm really sorry for this interruption. Okay, so how are you going to do this case? So basically the approach is going to be the same as we've been doing previously. You go and take a good history. The history should always be a nice one so that you are able to build a good rapport. The history is always for building rapport as well, especially in these counseling and ethics cases. The rapport building is in the history part, okay, from the beginning. You go in, you've called this grandson to your room or in a separate place where you need to talk to him, okay? So you're not talking to him in the ward in front of all the relatives and stuff. So you talk to him, hello, introduce yourself, take the details of the grandson and his grandma, Mrs. Anna Morgan, and then you start your history. I can see that you're here with your grandma. Is that right? Yes, doctor. Can you please confirm the name and age of your grandma? Okay. So I can see that she's terminally ill. Is that right? Yes, doctor. I'm really sorry to hear about that. How has she been doing? How has she been doing recently? So is she talking at all? How are you managing with all the stuff? It seems that you are really attached to your grandma. So many people are coming to visit her. It means that she must be a really famous lady. So you talk to her in a good way. Take your history in a good way. Don't jump onto the two people policy at all. Okay, build a good rapport with the patient. So what was she diagnosed with her, or with, and how is she being managed? Because it has not been given to you that how is she being managed. She is terminally ill and has been diagnosed with pneumonia or sepsis. So ask her what were the symptoms when she was brought in, how are the symptoms now, how are the family members coping with it, were you really attached to your grandma a lot? You take all that history, you give empathy. I'm really sorry that all your family members have been going through a lot. So how many people are coming to? So now, according to the COVID policy, sorry, the hospital policy, you need to ask him some questions. How many people visit him every day? At what time of the day do they visit him? Do you offer any prayers for him? You can ask those questions because you have that support in your history, in your stem, in your question. Okay, and I can see that your grandmom is being looked after by so many people who are coming from home. Once done, don't go to Meftosa. You do not need Meftosa here. She's a terminally ill lady and the family is aware of her condition. Okay, you are not going to do anything with the Meftosa. Just the family members of the Meftosa are important here. Okay, that how many people are coming to visit her and what prayers how they are offering the prayers and stuff. Then you go on to your management part. Well, Mr. X, I can see that you are a very loving and nice and caring grandson who has been coming to visit your grandma on a daily basis to make sure that you see her daily in her last days. And I can see that she has really caring family members around her. There's something really that's really bothering me a lot. I want to discuss certain things with you. According to the hospital, there's a policy called as two people policy. Are you aware of what that is? No, doctor, what's that? Basically, it's a hospital policy that at a time, more than two relatives should not visit her. It's very important that we keep the whole ward a bit silent, because there are many patients in the ward, and once there are more than two relatives, it becomes really crowded and the noise really disturbs the other patients as well. Okay, so we always advise every patient's relatives just to come one by one and visit the grandma. Okay, visit their relative in the ward. So that's what I would advise you as well. Okay, doctor. And another thing, it's very important that maybe you were not informed about it before, that 2 to 5 p.m. is the silent time. During this time, we encourage everyone not to come to the hospital to visit the patients, because during this silent times, most of the patients are sleeping or they are taking rest, and we've just put up this time for every patient to be in the ward on their bed silently to have some rest. Okay, you tell these things according to the COVID policy to the patient. Whatever they might put in 2 more points, whatever number of points are there, you need to tell all of them to the patient gradually. Once you've done that, usually this person is going to say okay to the policy very quickly if you have done it in a good way. If you are going to do in a very judgmental way, in a blaming way, he may become very angry. Okay, so you take a good history, do it in a good way, so that the grandson doesn't become angry. Offer him support. Okay, tell him that if you ever need any help, if you have if you ever have any problem, please do come back to me. I'll be able to help you with that. He sometimes asks that, can we bring in Bible and put it near my grandma? I have no issue with that. I don't think so that there would be an issue with that. But let me just talk to my senior. Since this is something new and has not happened in the past, I don't think so it would be a problem. But let me talk to my senior and then get back to you with that. All right? So never say no to their religious books or anything that they want to do. Right? Let them do. No problem at all. Sometimes he might say that I want to bring our priest to be here with my grandma and say some prayers. We have no issue with your priest coming. Anyone can come to visit her, but the rules are going to be the same. 2 people at a moment, at a time, and a silent time needs to be observed between 2 to 5 p.m. This is what is important for us, right? Done with the case. Thank the patient, give him support for later stages, and then you move on to your next station. COVID policy. I have no idea that why is this policy becoming so scary. It is even easier than this 2 people policy. It is so easy. So what's the problem? Just because it's new, we are getting confused. There's nothing to be confused. Always remember that you'll have the policy, the policy in front of you in the station when you go into the patient, and you'll have the policy outside in the corridor as well. Okay, so when you are outside, you'll have this question and the policy, both of them displayed in front of you outside and both of them in front of you inside as well. If you just have a look at this policy, when you are outside, you read the question, you are FI2 working in medicine. Mrs. Tessa Harden, aged 82 years, is admitted to the hospital due to respiratory failure. She is terminally ill and was put on palliative care. Her grandson has been visiting her regularly. So who has been visiting her regularly? Grandson. Her husband, who is 94 years old, wants to be added to the visitors list to see her. Wants to be added to the visitors list to see her. Other information is none. What you must do, talk to the husband and address his concerns. Hospital policy, what does this say? All the hospitals are encouraging virtual meetings, means to meet your loved one over the phone, over the video call. Okay, they are all encouraging not to visit the patient. In fact, do some video calls for them. Okay, one of my friends who is working in London in one of the hospitals, the COVID policy that I shared yesterday, I talked to her in lots of details about this case, and she told me that yes, we are offering, even sometimes we need to use our own mobile to do that, but yeah, we always offer this. Even before COVID policy, before COVID times, we used to offer this, and now in the COVID times, we are very frequently offering this video call meeting to the patients. Okay, but if the patient doesn't, if the candidate, if the relative doesn't agree, then what you are going to do? You are going to counsel him. Okay, don't be stubborn, don't be strict, don't be hard and fast on him. Visitors must be registered with their department. So this grandson must have been registered with the department. That's why he is the one who is coming to visit her. A visitor will be provided with PPE before entering the ward. They will be provided with the mask, with the gloves, and with the shoe covers or whatever PPE they are using for their hospital. They'll be providing with the PPE before they enter. Named visitor can visit the patient if they are less than 70 years old. So now 70 years is also very important. Any patient who is less than 70 years old and is registered with the hospital or with the ward will be able to visit the patient, but exemptions can be made if agreed. This word is very, very important for you to know. But exemptions can be made if agreed by the ward manager and consultant. These exemptions should be in your mind very clearly. Okay, it means that after you have counseled this grandson well enough, if he doesn't agree to what you're telling him, you can always talk to your consultant, provide him support that I'll talk to my ward manager and consultant, and maybe we can arrange your meeting with your wife. Okay, so you keep doing a good counseling, and if he doesn't agree, then you can arrange something with your senior. Don't say a no to the patient. As always, I've been telling you, Where you are FI2 working in the medicine. We've already read the case. 82 years old, has been in the hospital due to respiratory failure. She's terminally ill, put on palliative care. So you start taking the history as usual. I'm Dr. XYZ, one of the doctors working in this medicine department. I can see that you are here to talk about Mrs. Tessa. About your wife, can you please confirm the name and age of your wife? He confirms. All right, can you give me a quick recap of why she was hospitalized? So you are assessing the knowledge of the patient, of the attendant or of the husband. Yes, doctor, she was hospitalized because she had some cough, some fever, some shortness of breath, and then she was hospitalized. She has respiratory failure, and she's okay. Are you aware of how we are managing her? Yes, doctor. According to the consultant, she's terminally ill, and she has been. He might already be having all this information. If he doesn't have, please, you have to give this information. Don't get around the COVID policy too quickly. Do give this information. Her grandson has been visiting her regularly. Her husband, who is 94 years old, wants to be added to the visitors list. You already know that. So once you've taken a good recap of his knowledge, once you've taken a good recap of his knowledge about the treatment that is being given to her, ask him, how can I help you? Or ask him in the beginning, or ask him here, how can, doctor, actually, I want to be added to the visitors list to see her. All right, Mark, that's a very valid concern and request that you've put up. May I know that who has been visiting her up till now? It's our grandson who has been visiting her up till now. What's his age? He is 50 years old. All right, or he is 40 years old. All right. And how frequently has he been visiting her? Well, he has been visiting her almost on every other day. Okay, and have you up till now, since she has been hospitalized, have you seen her up till now at all? Have you had any video call meeting with her? Okay, so you just ask your normal questions like that. Have you heard her voice at all? Okay, she's on palliative care, most likely not speaking. So you just ask a few questions to him. I can see that you're really very caring husband and want to meet up your wife. But I have some information for you. You start your COVID policy. It's in front of you. Take all points one by one. Don't worry. They don't mind you looking at the COVID policy. You are not coming from the heaven to be able to remember the whole COVID policy in one glance. Okay. So you've already asked him if he has ever had a video meeting with the wife or not. Yes or no. Okay. He might sometimes tell you that we have been very attached to each other. We loved each other a lot. We had a very good relationship, a very strong bonding, and we always promised each other that whosoever will be on the deathbed first, the other one will be by his or her side. Or it was the last promise that we made to each other, that whoever will be on the deathbed will be holding each other's hand, will be giving support to each other, be with them even if the other person is not able to see, hear, or understand what's going on. I just want to see her, doctor. I just want to be with her. I can see that. Keep acknowledging. I can see that how close you are to your wife. And I can see that it must be really hard for you to go through all this at the moment. Okay, put in your IPS. This is an IPS station, very strong IPS station. Okay, so you start telling him that, okay, Mr. X, since you know that it's because of the COVID, we have some policies that have been changed in the hospital recently. It's all over UK. The policy is that the visitor who is coming should preferably be less than 70 years old, because people who are above 70, they are at greater risk of contracting the virus. So we highly suggest everyone to avoid coming over and meeting the attendants, and then they can have some virtual meetings over the video. What do you think about that? No, doctor, I just want to hold her hand, be by her side. I can see that. Well, if you be by her side, if you hold her hand, you are at high risk of contracting the virus. We really don't want anything like that to happen to you. She is on a terminal bed. We do not want that to be happening to you. Do you want to think about that? You can go home, take some time, think about that, because if you also contract the virus, it can really become troublesome for you. The virus affects every person in a different way. Okay, we do not want you to be suffering from any chest problems and any respiratory failure as well. Okay, so you try to counsel her as much as you can. When you come to the hospital, everyone, since it is spread through the droplets in the air, so I would highly suggest you to avoid coming here. Though every patient who is coming here, we do provide them with a personal protective equipment, but still it's highly advisable not to come to the hospital for those who are above 70. And it's a hospital policy that we allow only one visitor. Doctor, I just want to see her. All right, I can see that you really want to see her. So I can talk to my ward manager and to the consultant, since there is a possibility of making some special circumstances of bringing some special circumstances for you, since you're really close to your wife. So let me talk to my ward manager and consultant and get back to you about it. What do you think? Okay, doctor, I'll really be thankful for that. Do you have any other questions? Do you have any other problems? Do you have any other concerns at all? Give empathy, give sympathy, be by his side, be very nice to him. Okay, so that is what is needed from the station in the hospital policy. All right, nothing much. You have to be just sympathetic. It's not a big thing at all. So CSP, smear, homosexual, since we are all already late for today, I just want to ask you guys if you want to stop at this time and do these two cases tomorrow, since we have less cases tomorrow, I think, or you want to continue. You just don't unmute yourself, put it in the chat box. I just need 5 comments at least. Okay, all right. Okay, great. So tomorrow. All right. Let's go to the question answer session. Give me a second, please.